Good Saturday morning, everyone. Today on Perspectives, we're talking with the people who are leading the effort to provide medical care to those who've had little or no hope of getting quality professional help before. Victory Health Partners. They're dedicated to providing first-rate medical care to those who have never or have had little access to a doctor, a clinic, or a professional counselor. And it could not have come at a more important time. Mental health, in fact, is reaching a crisis level, especially among the youngest generation. A new survey from the American Psychological Association shows that nearly 80% of adults feel the coronavirus pandemic is a significant source of stress in their lives. Nearly 20% say that their mental health is worse than it was at this time last year. But Generation Z, or college-aged adults, are the most likely to report symptoms of depression. In fact, 2 out of 3 Gen Z adults in college say that the pandemic makes planning for the future feel impossible. Fear and anxiety about the disease and what could happen can be overwhelming and cause strong emotions in adults and children. The need to social distance to protect yourself and others can make people feel isolated and lonely, and can also increase stress and anxiety. Now, the CDC says that mental health issues tend to increase during a crisis like this.
As the pandemic continues, doctors are concerned about the rise of mental health and substance abuse disorders, and not just among those with existing illnesses. As of August, nearly 41% of adults surveyed by the Centers for Disease Control and Prevention reported struggling with mental health issues.
We see increases in the rates in which people are reporting depressed mood, trouble sleeping, changes in appetite and energy, worry, anxiety, and grief in the setting of the pandemic.
But this isn't unusual, according to Dr. Josh Gordon, director of the National Institute of Mental Health. He says increases in symptoms have been seen during other national crises, like extreme weather events and 9/11.
The pandemic is lasting considerably longer than the aftermath of all but the most severe disasters. And so we can anticipate potentially a more significant impact in terms of mental health.
Medical experts are now bracing for what they are calling a second wave of mental health devastation. This increase will likely overwhelm the mental health care system. And the most vulnerable population are the most at risk: frontline essential workers and people of lower socioeconomic groups. To help alleviate this stress on the mental health medical community, more funding is needed to screen and treat those at the highest risk. For today's Health Minute, I'm Meredith Wood.
We all need to know that you don't have to keep it all in. There is help available, and for many of you, it can be free of charge. For the past 17 years, Victory Health Partners has supplied medical care to those who do not have access to state, federal, or insurance programs. Now, they are dedicated to helping those who do not have medical insurance, and the numbers, unfortunately, continue to grow. According to the latest figures from the U.S. Census, 8.5% of Americans do not have health insurance at any point during the year. Now, that amounts to about 27.5 million Americans who go without seeing a doctor. Victory Health Partners is a nonprofit healthcare organization that provides affordable quality care for the low-income, uninsured population in the greater Mobile area. However, since its opening, people who need medical care have been coming to the clinic from all over the Gulf Coast. To be treated by Victory Healthcare, the qualifications are simple. You must have no form of private medical insurance. You are not eligible for Medicaid, Medicare, or VA health benefits. You must be between the ages of 19 and 65 years of age. And you have to have a gross income of less than 3 times the federal poverty guidelines. To learn more about this remarkable organization, you will hear from Kim Garrett, the director of Victory Health Partners, and Jason Byram, a counselor at the clinic. They're both here this morning to share the Victory Health Partners story with perspectives. In recent months, Victory Health Partners has received grants from private business and the government to help in its efforts to provide free mental health care to all patients during the COVID-19 pandemic. So stay with us this morning as we discuss how this organization has helped so many, how to know if you're eligible, and how you can donate as well to keep this endeavor going. Perspectives continues after this quick break. Our guests this morning, Kim Garrett, Director of Victory Health Partners, and Jason Barham, who is a counselor also at Victory Health Partners. Good morning, and thank you both for being a part of the program this morning.
Hi there.
Good morning.
We're talking about COVID-19 and some of the implications for mental health in our area. And of course, the numbers are just unbelievable and devastating when you think nationally. Now more than 8 million people infected with the virus and more than 230,000 deaths. And of course, our numbers in Alabama are part of the surge that's happening across the nation right now. When you decided to offer these services for people dealing with some of the other aspects of what has resulted because of COVID-19, how did that decision come about?
Well, it's just such a huge need for especially our patients. We've seen it. I know Jason can speak to it specifically within the mental health care counseling at the clinic, but it's just such a huge need. We've seen an increase of new patients at the clinic, patients who have lost their jobs or lost their benefits, patients who are coming back to get requalified. So we've just seen such a significant need, and we wanted to respond to that to provide care for our community.
Jason, what are you hearing from them? What are they saying to you when you first engage with some of the people who are coming in now?
Well, there's definitely a lot of anxiety that we see, a lot of the unknown as far as what's taken place in the last 7 months. So understandably, people are worried and upset, and we just hope to kind of be able to soothe that with our patients.
Kim mentioned the aspect of loss of job, and of course a lot of Americans and of course Alabamians have lost their employment during this time, and of course when you look at the numbers, we have a large amount of people applying for unemployment every week. Has that been one of the major factors you feel that some of the people are having this need to have someone to talk to?
I think certainly, you know, like Jason mentioned, that creates such an unrest, a stress, and for patients who might have already been dealing with some type of anxiety or depression, it's just compounded, and you add in social isolation, and then all the stress that I know parents have been feeling with the schools. I mean, there's just been so much right now, and for, you know, we were facing a mental health really crisis before COVID, and then you add this on, and so it's just been so much for our patients, and not only impacting their mental health, but then also their physical health. So it's been such a huge need, and we're so thankful that we have Jason. We have another counselor, Elizabeth Watt, who comes in and volunteers at the clinic. So having them ready to see our patients, and this is provided free for our patients. There's no additional cost for counseling. Every qualified patient gets access to this. So to have this ready to provide for our patients, really it takes a holistic approach to Victory's healthcare model for our patients.
Kim, you mentioned the aspect of the counseling being available for free, and also in some of the information that you've shared with me, the Robert Wood Johnson Foundation's information is saying that there's a major need for that type of service in our community.
Absolutely. The Robert Wood Johnson has a great county health rankings specifically for Mobile, and I know there's just such a huge ratio for the population to counselors, and really for any type of healthcare, whether it's providers or dentists. There's just such a huge need. I think before COVID numbers, there was 100,000 uninsured adults in Mobile and Baldwin County, and I know that certainly has increased with COVID and just the implications from loss of job, loss of benefits. So yes, it's definitely a huge need, and Victory is positioned, and we're ready to meet that need the best that we can.
Jason, looking at folks who may be for the first time in need of this type of counseling service, give them an idea of exactly if they're feeling this, that may be a reason why they should come and talk to you.
Sure. Well, I think anxiety is a normal response to the pandemic and everything we've had going along with it. But I like to encourage people that if the stress, if the anxiety is interfering with your everyday life, with your job, your relationships, school, whatever that might be, then we would encourage you to come and talk to somebody before it gets out of hand.
Give us an idea of how that process begins when you first have that initial opportunity to meet with you. Should you be in a certain mindset as far as prepared to share certain things? How does that work?
I think we just get to know each person individually and kind of see where they're at and go from there.
Now, as you look at this whole aspect of the pandemic, and it's been several months now since February and March for some people, depending on when it really hit their particular employment sector, do you see things improving for the people that are coming, who have been coming for a few months, or where do they stand? Are they still pretty much in that same position as relates to waiting for their lives to get back to some sense of normalcy?
Well, I think particularly with employment, the numbers are down. Hours are definitely being cut, which is affecting families. But we like to try to meet people where they're at, and we've definitely seen some meeting with the doctor and taking medication, and then some just doing counseling. We do see them get better, for sure.
Is there still a stigma about mental health and coming to talk to someone, or have things gotten better?
Well, unfortunately, I think that is still there. I think that's always going to be there to an extent. But I do see improvement in that, and I guess overall in the last 3 to 4 years.
Well, feel free to elaborate. Give us an idea of what you would say to someone who's considering it and still dealing with some stigmas that may have been something from either having been in the military, their family saying certain things about people who need that type of help. Give us an idea of what you would say to someone who's thinking about it, but they haven't quite felt the freedom to make that choice and that decision.
Well, I think the main thing with that is, you know, they can come and meet with us and speak, and they don't necessarily have to tell all their friends and family that they're seeking help for something like that. If they choose to, great, and they get that additional support, but I don't think it's critical that everyone know what they're going through, or, you know, how they're struggling and the help they're getting.
Yeah, it's amazing still that that's a stigma when you think about if you need certain types of treatment for major health issues and conditions, that people readily are looking for specialists, but when it comes to having someone to talk to and work out those issues that affect us mentally, we are still having that be a stigma in our society today. And here we are in, what, 2020 now, right?
Yeah, it is unfortunate.
So we hopefully will, from the program sharing today, get a chance to reach some people who are thinking about, I really could use someone to talk with to work some of these things out from that standpoint. And Kim, when we do our second part of this interview this morning, we're going to talk more about Victory Health Partners and some of the other services that are available through your organization. And I tell you, it's an incredible story when you think about how seeing the need, serving the international community and going on mission trips, helping others, that yeah, we need that here in America too, right?
You know, you're absolutely correct. It did start out on the mission field over in Guatemala and Venezuela with our founder, Dr. Lightfoot, serving abroad, and then they just brought it back to Mobile, so it's like a mission field every single day just right here in Mobile.
We're going to talk more about that after we take this break and come back and talk to Kim Garrett and Jason Barham of Victory Health Partners about some of the services they offer, as well as more about this whole aspect of having mental health care available for free in our community here, especially during this COVID-19 period. Perspectives continues in just a moment. We're back with our guest, Kim Garrett, director of the Victory Health Partners, as well as Jason Barham, a counselor with the Victory Health Partners as well. And especially during this time, we've been talking about COVID-19 and the impact that it's having in the lives of people that relate to areas of mental health care. And I guess one of the things, Jason, as we look back into this whole process and the stigmas attached, should the term mental health care be used, and is that comfortable with most people, or do we say counseling and dialogue, discussion? How do you approach that for many people today?
I would say you could go with either one of those. I think the main thing is just to reach out. Now, counseling doesn't have to be for everybody. If you're comfortable and you have a good support system, family, friends, that may be enough. But in some cases, I think it would help having a qualified professional to talk to. Not everybody's comfortable, like we said before, about opening up about their personal lives, but we're definitely here for that.
And looking at the information, we're seeing that some of the services that you all provide in the mental health care arena range from depression, anxiety, as you've talked about, bipolar disorder, and even schizophrenia.
That's correct.
Give us an idea of how those areas are dealt with as folks are coming to you for your services.
Yes. Well, I have noticed, I guess, over the last couple of months that the patients that come to see me, usually they'll see the doctor before. So definitely seeing more patients on medication for anxiety, for depression, for bipolar, for schizophrenia. So we're starting to see more of that. I think a lot of times medication and counseling can work wonderful together in concert.
The mental health care service being provided now is just one of the many that Victory Health Partners offers. Kim, tell us about all of the different services that are available for someone who may not be familiar.
Sure. So Victory really provides a full spectrum of health care for our patients, very a holistic approach. So obviously we've been talking about mental health care, but then also primary care is offered every single day. We have 2 full-time providers always on staff. We have specialty clinics that take place at Victory, ranging from pulmonary to neurology to wound care, minor surgery, OBGYN, dental, optometry, and those are all volunteer physicians who come into our clinic to see our patients. Medication assistance is a big part of what we do. So we enroll patients into the pharmaceutical company's patient assistant programs so that they can get their medication and take it as prescribed, which is something that can be very difficult for an uninsured patient. So say a diabetic, they can get their insulin for free. Last year we dispensed nearly $39 million worth of medication to our patients through that program. And then also mental health counseling, we have Jason and Elizabeth who provide that free of cost to our patients, like what we've been talking about. And the next step for our patients are our referral specialists. We have over 150 specialists who see our patients in their own offices. So if someone needs to see an orthopedic surgeon or a chiropractor or cardiologist, we can refer them as a Victory patient and they will be seen for about $25, $35. And even diagnostics like MRIs and CAT scans are provided for a greatly reduced cost, which sometimes for our patients, you know, that's what's needed to get that diagnosis and to get that treatment going. So incredible partnerships within the medical community, and we are so thankful for them because for some of our patients, it's life-saving partnerships, and we cannot be more grateful for them.
Now, we talked earlier about how Victory Health Partners came about. Share a little bit more about that story where the doctors Lightfoot were doing missionary work overseas, and of course, right here in the midst, we saw the need for something similar.
Yes, so Dr. Robert Lightfoot is our founder, and he was in general surgery for about 13 years with his brother at Providence, and just really felt the Lord tugged on his heart, and him and his wife started doing some overseas mission trips, and it was during those trips that really his comfort level shifted from the operating room to serving the underserved. And so he came back to Mobile. He knew that he wasn't being called overseas, but right here in his backyard, and started talking to the medical community to see what the need was. And time again, it was this group of low to moderate income working adults who were just falling within the gaps. So they were being seen at some other clinics, but just the volume was just overwhelming. So that's why we were appointed to serve this group, and we've stayed in that lane for the last 18 years, and the need hasn't gone away. We're still busy. We're still seeing, especially now with COVID, anywhere from 75 to 80 new patients a month, and we're with our partners, we're there and we're ready to meet the need.
And when a person considers Victory Healthcare Partners, it's not about them being low income, but the uninsured banner is sort of the thing that we're looking at, right? Because you don't have to be low income to be uninsured now, especially with what has taken place in the last 10 to 15 years in health insurance in our nation.
Oh, absolutely. We go up to 300% of the federal poverty guideline, which for a family of four, that could be $76,000. So that's considerable. So definitely a broad range of people qualify for the services, because you're right, just the cost is so great if you don't have that access through, employer-based health care. So if people are wondering if they qualify, if they don't, I always just encourage to go to our website, to call our new patient services, because probably you do, and we definitely want you having access to health care to keep you healthy and well, so that you can do the things that are most important. So being with your family, working, being engaged in our community, and certainly having your health and wellness along with that.
I think it's just awesome that you all are offering the mental health care right now during this time, because a lot of people's lives have completely done a 180-degree turn here since March. And Jason, bringing you back into that conversation, do you really have a sense of, I guess, either urgency or more energy now, because so many people are dealing with their lives being just upside down due to COVID-19?
Yes, I think a big part is the social isolation as well. So if we think about maybe patients that were struggling with depression before the pandemic, think about what that's like now. Somebody that's depressed may isolate, not return phone calls, not be with their friends or family. So I just think it puts it in a much more serious category, I think.
Kim Garrett, Director of Victory Healthcare Partners, and Jason Byram, a counselor there at Victory Health as well. We thank you both for joining the discussion today and the sharing of the information that you all are doing your part to make this community a better place, especially in the arena of healthcare. And right now, of course, with COVID-19 being a major issue in the lives of a lot of folk, mental health care that's available free of charge at this time. We thank you both for being a part of that discussion this morning.
Thank you so much.
Thank you.
Once again, Kim Garrett, Director of Victory Health Partners, and Victory Health Partners Counselor Jason Byram. We thank them both for sharing some very important information this morning on Perspectives. We'll be right back. Welcome back. To learn more about Victory Health Partners, you can check out their website at www.victoryhealth.org. Or you can call the number you see there on the screen. Victory Health Partners offers many healthcare options, from primary care to dental, mental health, diabetes, eye care, and so much more. Coming up next Saturday morning on Perspectives, Airbus, Mobile's aviation industry giant, celebrating 5 years of production at the Brookley complex. In 5 short years, the international company has become a major economic player here on the Gulf Coast. We'll talk with the manufacturing facility's vice president and general manager. He'll share the company's story, the incredible Mobile chapter. We'll talk about the industry and the expansion plans for Mobile. We'll also hear from Airbus's Director of Economic and Community Development, sharing about FlightWorks Alabama and FlightPath 9, as well as workforce development. Translating that, how do you find employment at Airbus? And we'll also talk to an Airbus employee in quality assurance. He has an incredible story of enjoying the Brookley Aeroplex as a young boy, joining the U.S. Air Force, working in the aviation industry, and lastly returning to Mobile to work at Airbus. It's one of those stories that you just have to hear. All of that next Saturday morning on Perspectives. Well, join us here on Saturday and, of course, Perspectives, as we discuss important issues and seek solutions. You'll have and hear of ideas coming up. I'm Eric Reynolds. We thank you so much. Have a great week.